So, as I've said, rather than looking through the children of prisoners through a lens of criminality or pathology, you know, further in-depth analysis is of them outside of their, which my research is currently doing. I'm only interviewing adult children of prisoners. I'm not interviewing parents, I'm not interviewing prison officers, I'm not interviewing anybody. I want their words, I want their perspective, and I want their experience. So, and indeed, a very important thing is policy recommendations would differ immensely were you to not view children through a criminal or a mental health illness lens. So mine is child-focused, although it's retrospective. I'm interviewing adult children of prisoners purely because I feel that they have much more referential life experience, and there is the debate about childhood studies and interviewing children. You know, is there a raw experience of childhood when a human grows and advances, matures? You know, we have much more referential. We have more to understand about ourselves in a reflective sense. My research considers children separately from their parents offending, and also controls for gender, age, socioeconomic status and ethnicity. There is suggestions out there to do pre and post imprisonment analysis. But methodologically, how difficult that would be. You know, how do we know that a parent, if it's a first-time offence, you know, how can you find those people? So, and also actually conducting maybe interviews with children whose parents are arrested and put on bail. You know, that child may have experienced the witnessing of a parent's arrest with dogs, with many police officers, etc., noise, chaos, 2 a.m. in the morning. What about their experiences as well? As a compare and contrast. And further analysis of resilience and protective factors. Really just to see what's happening in the children's lives and you know, are there any experiences that policymakers could learn from? I believe I'm running slightly over, so I'll skip a few. But really, my research concentrates on adult children of prisoners reflecting via virtual community, and alone, I'm analysing the data thematically, and alone pervades the whole. These are just a small amount of examples, really tiny. But if you look at their ages as well, and you look at the longevity of such effects of having a parent in prison, most statutory agencies are interested in children up to age 16. But after that, the research, there's nothing, barely anything. Mine. So it really doesn't go much further, and it's really interesting, and you know, it's good to know that I'm not alone. Some of the stories on here are so similar to mine. That's comforting. It's nice not to be alone. So, and just this one, strategies to manage stigmas may include withdrawal and limiting one's participation in society fully. So I have never talked about my father in detail to anyone, not even to my mother or to serious relationships. And I know that my friends are just curious and trying to be supportive, but I don't even know how to talk about it because I've been running away from those feelings for so long. So isolation, social exclusion, and self-censoring really comes through.